Best home remedies for back pain, advice from a physical therapist. Keeping your back happy. Back pain can interrupt your day or interfere with your plans. In fact, there's an 80% chance that you will develop low back pain in your lifetime. But back pain isn't always something you can ignore or wait for it to resolve on its own. If you're not sure about the severity of your back pain, you've had pain for more than a month, your pain is worsening over time, or you're developing new neurologic symptoms such as numbness or weakness in any part of your body, it is best to see your healthcare professional. The good news is that even though it can be very painful, back pain isn't usually cause for alarm. Most people will experience it at some point in their lifetime. Most of the time, the pain resolves, and the person returns to normal pursuits. If back pain happens, try not to fear it and continue to try to function despite it. Whether you choose to seek out a healthcare professional, there are things you can do at home to relieve back pain and help reduce the chance of it happening again. Thankfully, there are several ways to treat back pain at home. These remedies include everything from herbs to massages. Keep watching to see how you can ease your back pain at home naturally. Please subscribe down below to keep you updated on everyday health-related tips and best home remedies here on Green Life Hub. 1. Stretch, strengthen may improve back pain. Strong muscles, especially in your abdominal core, help support your back. Strength and flexibility may help both relieve your pain and prevent it. A lot of times, I encourage people to do that first thing in the morning. But if you're older or worried about overdoing it, you can stretch and do your strengthening exercises later in the day when your body is warmed up. If the primary issue causing back pain was limited motion and stiffness, it's likely the therapist would prescribe some stretching exercises. These could be done with a therapist or independently at home, he says. Yoga, Pilates, and Tai Chi are just a few of the ways to strengthen your core and the muscles around your hips. One exercise that targets your entire upper and lower back is to lie on your tummy and lift up your legs and arms in the flying position. 2. Maintaining a healthy weight can help reduce back pain. Shedding extra pounds lightens the load on your lower back. Weight loss really helps with pain, because it reduces the amount of mechanical force onto the spine. If you're at a healthy weight, your muscles don't have to work as hard to support you against gravity. The muscles won't fatigue as quickly, and that would be helpful with pain. There's also less pressure on your back and other joints. If you need help, ask your doctor for advice on a diet and exercise plan that may work best for you. 3. Quit smoking. Research suggests that if you smoke, you may be 4 times more likely than non-smokers to have degenerative disc disease or other spine problems. Nicotine in cigarettes and other tobacco products can weaken your spinal bones and take away vital nutrients from the spongy discs that cushion your joints. A healthy spine keeps your back flexible and its muscles from getting stiff and sore. 4. Know your over-the-counter, OTC, medications. Non-prescription pain relievers can help with muscle aches and stiffness. The 2 main types of over-the-counter options are non-steroidal anti-inflammatory drugs, NSAIDs, which include aspirin, ibuprofen, and naproxen. The other type of over-the-counter medication is acetaminophen. True to their name, NSAIDs help lower inflammation that can lead to swelling and tenderness. But acetaminophen does not relieve inflammation. You can reach for either type of pain reliever for occasional back pain. NSAIDs may work a bit better if you have arthritis of the spine or other inflammatory conditions. Note that NSAID use can increase the risk for severe or life-threatening gastrointestinal bleeding and ulcers in some people, and taking too much of these drugs can also lead to liver or kidney injury or failure. 5. Temporary pain relief with ice, heat, or both. You may have heard that one is better than the other for relief from back pain. The short answer is that the best option is whichever works for you. Usually, ice is best if your back is bothered by swelling or inflammation. A heating pad may be better if you're trying to relax stiff or tight muscles. Studies suggest limiting ice or heat treatment to 20 minutes at a time. And don't use them if you're also putting muscle ache creams or ointments on your skin. 6. Exercise and movement can prevent and help relieve back pain. In my experience, people who tend to move more often throughout the day tend to experience less frequent episodes of back pain and often less intense back pain. However, this rule may not apply to people who have more physically demanding jobs that require a lot of lifting. Generally, Most types of physical activity are somewhat protective in terms of the likelihood of developing back pain and also the prognosis. If someone is habitually physically active, that seems to have some preventive benefit, and if back pain occurs, it helps the person get through it faster. Also, try to keep up with your usual level of daily activity and movement. It can be a brisk 30-minute walk or circling the block with your dog. Aim to get on your feet at least 3 times a week. Being sedentary allows the muscles around the spine and in the back to become weak. That in turn can cause less support for the spine and lead to long-term pain. 7. Keep good posture. This helps ease the pressure on your lower back. You can use tape, straps, or stretchy bands to help keep your spine in alignment. Aim to keep your head centered over your pelvis. Don't slouch your shoulders or crane your chin forward. If you work in front of a screen, rest your arms evenly on the table or desk, and keep your eyes level with the top of the screen. Get up from your chair and stretch and walk regularly. 8. Rub on medicated creams. Skin creams, salves, ointments, or patches may help when your back feels stiff, sore, and tense. Many of these products contain ingredients such as menthol, camphor, or lidocaine that can cool, heat, or numb the affected area. Put on creams right where you hurt. Ask someone to apply it if you have trouble reaching the spot. It's not going to be a mainstay at providing significant relief, but it can calm things down. 9. Address back pain sooner, not later. If you have tried adaptations such as improving your work setup or adjusting your posture and don't have any improvement in pain within 2 to 4 weeks, you may want to seek a formal consultation with a healthcare provider or physical therapist. It's not a good idea to live with pain too long. Physical therapists can usually be of more help if you come earlier in your pain episode. In the past, many doctors recommended bed rest for back pain, but that's no longer thought to be a good solution. We're pretty sure that doesn't help you get through an episode of low back pain any faster or end up with a better result. There's nothing wrong with taking it easy for a day or two, but that's really the most that someone should be following any type of bed rest. After that, they need to try to introduce movement, because that's so important in helping tissue heal and relieve back pain. Thanks for watching. Please subscribe for more tips like this here on Green Life Hub.